And then I listened to the book, and she talks about this amazing thing called the burn the house down moment, where you just want to walk out of your life and not look back. So you don't want to burn your house down, but you just want to walk, and off you go, and that's it. I'm done now with this part of this life. And actually, I've said that to some patients, and they go, that is it. That's exactly what I feel. I don't want, I don't want to hurt anyone or leave my family or anything like that, but I just want to do that. There's real pull to do it. And actually, it was a real light bulb moment for me, because I realized that's how I was feeling. I didn't, of course, want to leave my family, but part of me just wanted to just get out of everything and not be where I was, not feel that way. And I really resonate with women who say that now, because I think I totally get what you feel. But this is a journey, and that isn't always going to be the way that you feel. So making big decisions like leaving your family, leaving your husband, leaving your job it's a burn the house down moment, because you just want to get out of it. You want to leave. You want things to be different or better, or you don't really even know what you want, but actually you just don't want to be there. If any woman chooses to take hormone replacement therapy, then it's really important to understand what the benefits and the risks and any potential side effects are to that woman, because we all come in with different type of body, different medical conditions, different family history and genetics, a different lifestyle, so modifiable risk factors. So we have to assess each woman individually. It is felt that when we look at all the data, so the Women's Health Initiative study and all the other studies that have been done looking at it since, that actually taking HRT, the benefits outweigh the risks in most healthy women under the age of 65. Some women, there are very few women that cannot take HRT, but we may need to look at the dose and the preparation and the type of way they take HRT in order to give it to them in the safest way. There are some contraindications to HRT, for example, like being pregnant, like having an estrogen-dependent tumour, active blood clot, very abnormal liver function tests. But everything is individual, and we now really assess each woman for looking at their quality of life and the impact of their symptoms on their quality of life when we're making an assessment on whether we think it's safe to give or not. There are some types of cancers where it would not be recommended, but there are lots of cancers that women can have where they can have HRT. We get loss of words by about 1 in 16. And some women, say 25%, suffer from this in a significant way. And then people often will come to see me going, right, well, I must need more estrogen, or I need testosterone for this because I just can't remember anything. And what can I do that's going to make this go away? I've been on HRT and it's just not helping. See, really, I have very few symptoms, but this isn't going. And we don't know whether HRT helps improve brain fog and memory in perimenopause. We have some studies in postmenopause that show, how it can affect women then. But we know that there seems to be a gradual improvement in the brain fog. But that's difficult, and it can take a number of years for many women. Some get better really quickly when they take hormones, and others simply don't see much of an improvement. So do we need higher doses? Is that going to help things? Do we need testosterone? Well, there's no evidence from randomized controlled trials that testosterone helps with brain fog. So what could we do?